Hello out there and welcome to Public Conscience. This is the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMOG. PRIMOG is a civil society organization with the mandate to promote good governance, participation, and accountability in Nigeria. I am Chidozie Ogbonnaya. I'm with Adaobi Obiabumo.
Welcome to the program.
On Public Conscience, we seek to evolve a corruption-free society through the amplification of corruption stories reported by our partner media organizations and drawing citizens and government attention to democratic actions against it. We also promote integrity by focusing on rare cases of the display of honesty by public and private individuals in the course of their normal activities. The MacArthur Foundation supports the production of this program.
Today we will be looking at a very important subject, which is the persistent increase in maternal and child mortality in parts of Nigeria, particularly in Nasarawa communities, despite multi-billion naira spent to fight the menace an investigation reveals.
This report was published by the solacebase.com with the support from Wole Soyinka Center for Investigative Journalism. It exposed that maternal and child mortality remained unabated across communities in Nasarawa State, with the lives of pregnant women and their newborns put in jeopardy.
Maternal mortality is defined as the death of a woman from pregnancy or related causes during pregnancy or within 24 hours of giving birth, while child mortality is the death of children under the age of 5. And sadly, Nigeria accounts for 20% of maternal deaths globally. According to the report, Nasarawa State loses about 700 women per 10,000 live births and 103 children per 1,000 live births annually. And based on these disturbing statistics, Nasarawa State received at least $3 million from World Bank's Save 1 Million Lives initiatives in 2016.
The disturbing aspect is that despite the billions of naira invested over the years in Nasarawa State to improve maternal and child health care, a good number of the women are said to have access to antenatal and postnatal services rarely. Pregnant women are losing their lives because they cannot access prompt medical service during labor and delivery.
Without any doubt, something is wrong with the management of funds from the Save 1 Million Lives initiatives. The fact that most primary health centers in rural communities are not equipped with drugs and well-trained personnel has a lot to do with how public sector corruption is rubbing off on people in the rural areas.
For you out there, do you know that Nigeria has about the worst maternal mortality rate in the world? What do you think is responsible for government's inability to address the increasing rate of maternal and child mortality in Nigeria? And how much do you think corruption has affected our health system as a nation?
So be ready to join us through phone and text messages in the course of the conversation. The WhatsApp phone line to send your message to is 0902 265 6167. Let me quickly remind you that we have been talking about an investigative report on the increasing maternal and child mortality in Nasarawa State, despite the multi-billion naira spent over the years through the Save 1 Million Lives initiative.
The joy of every pregnant woman is to smile at the end of her pregnancy with the safe delivery of her child. But the shortage of functional healthcare facilities through lack of qualified health workers and drugs continue to compound the woes of pregnant women and their newborns in Nasarawa communities. In the year 2020, the federal government launched a platform to improve maternal mortality in Nigeria. This platform is yet to bear the desired fruit, especially in rural areas.
We invited the National Primary Healthcare Development Agency to join us in the conversation. We are hopeful that they will. But to broaden this conversation, we will be joined by an investigative journalist, Elijah Akoje, and the media consultant and activist, Princess Halima Jibril. You're welcome to today's episode of Public Conscience.
I'm indeed glad to be here.
All right.
While we are waiting to speak with the journalist who did the report, let's start with you. How would you react to the investigation? Could you give us a sense of how difficult and dangerous it is for our women to give birth in unhealthy facilities?
Thank you very much. You see, when I read that report yesterday, I wasn't myself because it is ordained that women should give birth. And every human being on earth today was given birth to by a woman. And then the care for women to give birth is so low in Nigeria. I think the lowest in Africa and the sub-region so far. I read testimonies of how men watch their wife trying to deliver and they die and the baby dies. How they carry them on the back of motorbike. The same space will take the husband and the pregnant woman on the same motorbike, riding for kilometers to be able to reach a health facility to give birth. And despite all those troubles, they get to that facility, the health service providers are not there. And if they are there, they don't have equipment, to medical aids to do their job.
Okay.
So, for me, it is a very big indictment on the government of Nigeria.
A very big indictment.
Yes, indeed.
I will have to come back to you because right about now we have Elijah Koji, the investigative journalist that did the story, joining us. Elijah, welcome to the program. Let's start with a quick overview of your report, and especially why did you choose Nasarawa as a choice?
Over the years, there are statistical indications that point to the fact that Nasarawa State top the ranking state among states with issues of maternal mortality. And this became a non-resolving issue for them, and there are a lot of investments made by both the National Primary Health Care Development Agency, the state primary health care agency, and even the state government and the federal government as well. So all of this came as a spotlight for me that despite all these investments, issues of maternal mortality continue to be a threatening question for pregnant women in the states. So I launched this investigation into the Save 1 Million Lives. And the World Bank program that is channeled towards ensuring a functional primary health care center to protect life of pregnant women, particularly in the age of 0 to 5 and other stuff like that.
Let's go into details. Why you thought or you believe that this multi-billion naira Save 1 Million Lives project is yet to achieve its intended objectives in Nasarawa State?
Okay. I think the big question here is, how do people tend not to ask certain questions? For example, if that collect $1 million in 6 and also collected another $7.5 million again. I think this should raise a sensitive question in the mind of people to be like, okay, this is a huge sum of money. If Nasarawa State has $7 million and they will have one functional primary health care.
And it will be fine if you tell us actually what you saw on ground, the state of the facilities you saw on ground that made you come to that conclusion that the money is not put in use.
Very good. The deplorable state of this primary health care center is something to be worried about. For example, in Buku community, in Panda local government, if you go to that report, you see a clear picture of how this Boko Primary Health Care Center looks like. Now, this is a place where you cannot even rear birds to say, because of what? They also require a very healthy environment to survive. Now, we discovered that one, some of these women still patronize traditional birth system. Traditional birth system in the sense that some of them prefer to go to these people and deliver instead of going to the hospital, these primary health care centers that is located close to them. And their reasons are, one, there are no midwife staff that should cater for them, no experienced midwife staff. Two, there are communities whereby have lost their poor attention on them. So you see, all of these begin to raise the question: what happens to the fund that is supposed to provide professional workers in this community? And these are communities, these are primary health care centers that are supposed to at least have one or two midwife staff that usually they should run in shifts, one in the morning and one at night. All of these were not taken in.
Does this situation cut across all the local governments in Nasarawa state?
There are drawing your conclusion, a selected local government you use to draw your conclusion. And if you go to the report, we were able to select these big local governments. For example, Akwanga is a local government that is big enough. I think the total population, according to NPC, is around 600,000 to 700,000, thereabouts. So you come to realize that this is a very populated local government that ordinarily should have a functional healthcare system. So using this as a parameter to draw a conclusion, we came to realize that most of the funds were properly accounted. If they were, it's a performance for result-based program. So it means that this performance can be measured by the number of health workers you see across these primary health care centers.
You've established that the $3 million from World Bank for the Save 1 Million Lives initiative, it's not commensurate with what you saw on ground. So how did these funds get filtered away from your investigation? Were you able to track some of these funds?
You know, some of these funds are already public information that they can't hide, especially when it's a funded project by either World Bank, UNICEF, or USAID. Now, most of these programs, they make their information very public in the sense that whatever each state is getting is made public. And you know, in 2015, it's a $500 million US credit facility that was given to the federal government. So each state, as at that time, was given 1.5 million US dollars. And even the manager of the Save 1 Million, though while we were asking her questions and never wanted to, she was able to establish that so many primary health care centers were located, so many primary health care centers were constructed and the rest, but she could not show us practical evidence where these primary health care centers were established.
Many thanks for the insight you've given to us on the investigation you carried out.
Thank you very much. Thank you very much.
This is Public Conscience, and we are talking about child and maternal mortality in Nasarawa, a story written by SolaceBase.com on how that has persisted in Nasarawa State. Back in the studio, we still have Princess Halima Jubril with us in the program. Maybe you want to go on and comment on what you heard from Elijah before we take the next guest on phone.
Okay, what he just said is buttressing the investigation that he did. That investigation was very in-depth. But what I didn't find very vague in that investigation is that every local government is supposed to have a primary health care center. You know, primary health care delivery centers were the brainchild of Professor Olikoyera Somputi, knowing that it's only through primary health care that health delivery can get to the grassroots. And over the years, the National Primary Healthcare Development Agencies, headquarters in Abuja here, have done so much with the primary healthcare sector, especially in immunization, medics delivery from all these international agencies. And then the midwife scheme, I think there was sometime in 2010 or 2011 or thereabouts, where the National Primary Healthcare Development Agency actually trained midwives as birth attendants, and they actually also trained traditional birth attendants to give them an insight of especially hygiene, because there are so many communities so deep that before they can even get to the primary health center, the deed would have been done. So they try to recognize some of them, and they trained midwives that are supposed to operate in each of the primary health centers in the 774 local governments in Nigeria. But I am sure that scheme is still on. But whether they have been retrained over the years,
you don't know.
I don't know. Whether they have been properly funded is another case altogether.
A very serious issues there, Adobe.
Absolutely.
Because the funding is a major thing. Another thing is utilization management of the fund is a very serious issue. But over the years, there's been a lot of assistance from international agencies to reduce this maternal mortality. What do you think is responsible for Nigeria's slow progress in reducing it?
It's corruption.
Straitjackets.
It's corruption. The health system is bedeviled with corruption. When you look at the amounts that international agencies have put into Nigerian health sector, apart from the fact that Nigerian federal allocation to health is the lowest in Africa.
Okay.
But then there has been so much assistance from the World Bank, from UNICEF, from UNDP, from so many of them that are largely unaccounted for. Because where fund is earmarked to curb a purpose, for instance, to check a purpose like this, maternal and child mortality, and the fund is dispensed, and the receiving states cannot give accounts of it. Giving account is, it is physical. Let us see the progress you have made. If you have even built structures, let us see the structure. Like what Elijah just said just now. The physical structures that they say they are not available for view. They are not available for view. So which means that there's a clear lack of accountability. A very clear lack of accountability. And there is a lot of connivance. There are lots of connivance from the government agencies and from the health centers themselves that are supposed to be receivers of them.
A lot of connivance.
A lot of connivance, because it takes two to tango.
All right, let's also get the perspective of Nigerians on the streets. Like before this program, Primog hit the streets and sampled opinions of some Nigerians on whether corruption is majorly responsible for the government's inability to address the increasing rate of maternal and infant mortality in Nigeria. Take a listen.
Voices against corruption. Let the people speak.
Hello and welcome to Primog's public feedback series on corruption, called Voices Against Corruption. And we ask, do you think corruption is majorly responsible for the government's inability to address the increasing rate of maternal and infant mortality in Nigeria?
Corruption has greatly affected the maternal and mortality ratio because our hospitals are not properly equipped. If our hospitals are properly equipped, this age that we are in now, women are not supposed to die in childbirth. So I will say that corruption has greatly affected this sector. Our health sector should be properly equipped. You go to a hospital, the number of doctors attending to the patients are more than the doctors.
I think mother and child mortality rate with regards to developing countries like Nigeria has been traced to have more like a hydra-headed challenge. It stems from one, public health policies, the failure of public health policies. And I think one of the reasons for the failure of public health policies would also have to do with national will and commitment. I think that's where corruption comes in.
The major cause of this is the level of poverty, because you see most of the pregnant women, you see them going to the healthcare centers where they will pay less or more or less paying nothing to attend to them. But these pregnant women, they actually did not know the implication of what they are doing. Some lost their life during delivery because there's no proper care. There's no doctor, expert that can really monitor them. There's no consultant that will actually take care of them and know their conditions.
If from the grassroots, the things that are supposed to be done, if they do it, so that these mothers and infants will have access to adequate health care, the mortality rate will be reduced drastically.
With corruption, no supply of equipment in the hospitals that needed to be used to save lives of mothers and the children. And in another case, corruption is an issue because they don't employ experts on that field to do the work.
When you come to the country or in a home where a man or woman is corrupt, everything goes upside down. Because a corrupt-minded person never knows when he cheats himself or herself. So when you see things that happen in this country, I will tell you 100% plus 100 is out of corruption.
Primark's public feedback on corruption in Nigeria is produced with support from MacArthur Foundation.
You just heard the voices of some Nigerians on the street on the reasons why the rate of child and maternal mortality continues to be on the increase.
And Adobe, they talked about poverty, funding, and most of them harped on corruption. Princess Halima, what's your reaction to what you just heard?
You see, we are now in a civilized global community where you can even get information online if you are a trained health. No matter how qualified you are as a health personnel, you need training and retraining on modern tools and whatever. And the facilities needs to be equipped, because even if you are trained and retrained, because there are a lot of training actually going on with health care deliveries from civil society.
But that's the big question.
So,
are the facilities
so what I'm saying is that no matter the training they get, if the facilities are not equipped, for instance, those training will just be in abeyance. So that is actually what is happening. You see, like a month ago, I was in Kefi to volunteer in the health facility there, Angwa Uji, the primary health care center there. And when you get there, you don't see anything modern to show that this facility is ready to take in people or is ready to treat people well. And I begin to ask myself, Kefi is in the heart of Nasarawa state. So how come Kefi is not a rural, so deep a rural community that they know that just by a stone throw from FCT, you get into that place and you see clearly what has been done and what has not been done. And you find out that almost nothing has been done there. So it's like it's clearly in nearly all the local governments in Nigeria, not just Nasarawa state.
With about 30,000 health centers, do you think it's enough to cater for the needs of Nigerians, health needs of Nigerians?
Absolutely not. Not forgetting that they are private sector practitioners. We are talking of public. The ones we are talking about in public view now is not even enough. Because when you go to up north, for instance, it takes like traveling 5 to 6, 7 hours within a local government. You understand? Yeah. Because they have a very vast area to cover. Whereas down in the south, you may not travel that far. Long. So what it means is that they need to introduce more primary health center using a survey method to know how many citizens can a particular healthcare center cater for at the same time?
Absolutely.
And the number of hours that people need to travel before they access those health facilities.
I agree with you completely that more needs to be done. But at this point, Adobe, I think it would be nice to bring in a listener to join us.
Please follow us on our social media platforms at Official Primorg.
The WhatsApp phone line to send your message is 09022656167. That is 09022656167. This number is for messages only. How can maternal and child mortality be reduced in Nigeria? What do you think is responsible for government's inability to address the increasing rate of maternal and child mortality? And also talk about how much do you think corruption has affected our health system as a nation. Hello? Your name and where you're calling from?
Yes, my name is Osmosola from Abu. So, if the government of the day can want to arrest the situation, one thing is to put money into the another thing is to monitor the money. Because many of the time, the federal government will inject money in our hospital, but they don't monitor it. Before you know, the money will enter in the wrong hand. They will cancel it. And if you go to the hospital today, one doctor will be attending up to thousands of people. And at the end of the day, some people will be disappointed not to see a doctor on that in the hospital. Actually, God bless you.
Thank you, Apostle, for joining us. I must say this. We have shortfall, like he mentioned, that we have shortfall of doctors, not enough to cater for the needs of our hospitals and health centers across the nation. But the fact is that the little money or the little resources put in is not being put to adequate and proper use.
Besides that, there are shortfall of doctors. You see, doctors don't also want to stay in the very rural communities where some of these primary healthcare centers are located because of a lot of reasons. And then the other aspect of it is that if monies are pumped into these primary healthcare centers, is there proper monitoring and evaluation of those monies?
Okay, President Jibril, I will have to hold you up there. We have a medical doctor joining us, Dr. Laz Ude. Let's quickly start from you giving us the benefit for sharing with us the major causes of maternal and child mortality, at least for the benefit of the millions of Nigerians listening to us.
Okay, thank you very much. Maternal mortality in the first place is a situation where lives are lost. Women die in the process of giving birth to life from pregnancy up to 6 weeks after delivery. That's in the case of definition. And the common causes in this part of the world, number one is bleeding, excessive bleeding. And that occurs after childbirth, and a lot of blood is being lost from the womb. Of course, there are measures to prevent that. The third stage management of labor, certain injections are given during childbirth to make sure that doesn't happen. And that's why it's important that women deliver in a health facility, in a health center, and all of that, where these medicines are available, and they can be given that to ensure that they don't lose so excessive blood. Number two is preeclampsia or eclampsia, also known as hypertension in pregnancy. For some reasons, for some people, they may have high blood pressure that is associated with pregnancy. In some cases, it might be so severe that you may even have to terminate the pregnancy to save the life of the woman if it gets to that. Some people, theirs even begin after childbirth. There are those that they would have delivered and suddenly their BP will just begin to go very high. So it happens during pregnancy and even within 6 weeks after childbirth. That's preeclampsia.
eclampsia. It becomes eclampsia when it's associated with seizures or convulsions, and it can be very deadly. You must never be allowed to get to that. This is why it's also important that every pregnant woman attends antenatal care, because it's only then that the blood pressure will be checked, and if it's excessively high, things will be done to check it and monitor it very closely. And if it comes to the extent of having to take out the baby to save the life of the woman, that decision will be taken by the obstetrician and gynecologist, or whichever doctor that is taking care of that.
Okay, thank you, Dr. Las, for that background that you gave us. But it's one that the country, I believe, understands that needs to be tackled, which is why huge financial assistance from foreign organizations has been pumped into Nigeria to help reduce the child and maternal mortality. But despite this money, Nigeria is still ranked highest in the world. Why are we where we are at the moment?
There are many reasons why we are where we are. Our healthcare system is very weak. I get tired of talking about this, but it's still what it is. Despite about $500 million, save 1 million lives, that was made available on loan. This money is not dash. This is loan money that Nigeria is paying back. World Bank money most of the times are loans that we get to pay back. And unfortunately, I'm not sure if we've saved 1,000 lives, because the NDHS survey, actually showed increase in maternal mortality between 2013 and 2018 National Demographic and Health Survey, which is not good at all. So we are not getting value for money in as much as we say we need more money for health, but the one we have available, we are not getting value for it. And it's that way because healthcare workers are inadequate. Across states, across different states, we do not have adequate number of healthcare workers, whether it's at the primary healthcare center or at what is adequate at the full-fledged primary healthcare center. We should have at least 4 nurses and midwives, 3 community health officers, community health extension workers, 1 pharmacy technician, 1 lab technician, record officer, security people, and all of that. Even chiefs, those they call chiefs, and all of that. So the entire staff strength of a fully fledged primary healthcare center, which should have at least 1 per ward, is 35. That's what it is.
Dr. Laz,
yeah.
Most of the people who interacted with on the street believe that corruption plays a major role in we not getting the value for this money we are talking about. What's your position on that?
Yes, it depends on what they consider as corruption. A lot of things are being covered by corruption, but specifically, sometimes medications are made available, drugs are made available. Sometimes the health workers may sell part of it, the bad ones among them, not all of them do that. They even sell part of it or channel some to their private clinics. Sometimes people go to health centers and steal drugs or supplies and all of that, go and sell somewhere. A lot of things happen. But one thing that could help to check this, because we can analyze the problem till tomorrow, I like always looking at the solutions, is health committees. The National Health Act 2014 and the World Health Systems 2018 made available for every village and community to have a health committee. That's like the Ministry of Health within that community or village. So that committee has a lot of responsibilities. They are volunteers. They are not being paid for it, and they are also the chairman of the committees are also members of the World Development Committees. So they help to draw attention to the primary health needs of the community and also solve the ones that they can afford to solve and make sure that they keep reminding their elected representatives and holding both the health workers accountable and themselves accountable. And because these committees are not in existence in many parts of Nasarawa state as well as the rest of the country, and when they are in existence, they see it as political appointment, especially at the ward level. So they don't get to hold people accountable.
So on the overall, the committee is also not working.
In many cases, they are not, because if you look at the World Health System document, section 2.2.2, and where their functions and their composition is well outlined, you see that it's not working, because they should be asking certain questions. If the health worker is not cooperating with the community, they can get those persons out. And again, government officials should also be actively engaging with the community. If these committees are in existence and they know that this is what is coming from government to the health center, these are things they should respect in terms of quality of service. They'll be able to ask questions and help those things to happen. So to curtail this, government alone cannot do it, because this work is shared. So the community owns the health center, primary health center. That community ownership is a major component of primary health care, which if you take it away, then things cannot go right. So communities must take that ownership and begin to play their roles in holding both themselves, the health workers, as well as the government accountable.
Government cannot do it all alone. They cannot fight corruption in the health system alone. Thank you very much. And as we wrap up in 30 seconds, you are an activist also. What would be your advice to the the Nigerians out there on this subject, on child and maternal mortality rates in Nigeria?
Yes, let's keep spreading the message. Let's keep ensuring that every pregnant woman gets to attend antenatal care and gets to deliver their baby in a health facility. That's really very important. And let's also, through our communities, ask questions. Go to a health center, ask questions, find out their needs. Know the ones that communities can help to solve, and begin to make demands, even in writing, to the authorities. It's all our work to ensure that we make our hospital work and we make our primary health system work.
Thank you so much, Dr. Laz, for your insight at this time. We sincerely appreciate your intervention.
Yeah, you have it, Dr. Laz Ude, a health physician there. Spoke on a whole lot of issues, gave us a professional perspective to the issue. Let's quickly see if we can take more calls before we wrap up this program.
Yes, while we are waiting for the calls, we have a message from Taiwo, and it says,
it's like an epistle.
It's an epistle. It is agonizing what horror and trauma our women go through in most of these public health facilities. May I suggest that women should stop conceiving to depopulate the country? What a suggestion, Taiwo. Perhaps the government and civil servants would know the implication. Okay, citizens should make it a civic responsibility to always interrogate these issues with a view to reduce or get rid of the menace. Nigeria will be great again in my lifetime. Let's join hands to make it work. Thank you so much.
We just had to abridge your message there. Was quite long. But the truth of it is that he's talking about the fertility rate. I think we are very fertile in this part of the country. But let's get back to Princess Jubre. And you want to react to what Dr. Laz said and what the text message read?
You see, Dr. Laz, I know Dr. Laz and is very vast. The civil society that are involved in the health sector, for instance, they need to group and regroup. They need to interrogate a lot of things that are happening in the health sector, both at the national, state, and local governments. If they don't do that, this condition that we are now, we are going to be here for long.
But it's man in humanity to man. When we talk about
those that are corrupt, they are blinded by the goodness of life for their own selfish reason.
To the detriment of others.
If you go to, in my hometown, the primary healthcare center is just adjacent my father's house. And while my father was alive, my father was one of the people contributing to everything they were doing. The community pulse will release money to buy medication. Even the health personnel, they will steal the medications.
Quite unfortunate.
It's still happening as we speak today.
Okay, and because of our time, in 1 minute, how do we reverse the high rate of child and maternal mortality?
Reversing it has to be in consonance with, you see, what the community
committee
that is talking about now. If this committee is constituted, for instance, and they are meant to understand that it is a volunteer corps. Like as a Rotarian, we have what is called a community volunteer corps. If they are told that it is not going to be a salaried thing, it's just a volunteer for your wives, your daughters, your children not to die, so that you keep your eye in the primary health center and you monitor the activities of the primary health center and make sure that what is supposed to be done there is done right. And then the next thing is that when they do this and there are fault lines, who do they report to that will take action? Because if they do all these things, there are fault lines, and they report and action is not taken, are they still going to continue? Which for me, they should continue because it affects their life. It affects their daughters' lives. It affects their wives' life.
Okay.
Losing women and children at childbirth in Nigeria needs to stop. I have been in advocacy since 1997, talking on this maternal and child health, and from close to 25, 26 years ago, we are still repeating the same thing year in, year out. Accumulating loans that the generation yet unborn are going to pay. And yet, once the money comes, they just disappear into the thin air.
Quite an unfortunate situation.
And then, let me also say that what the community corps can do is that the rich people in those local government and wards, they can always do an annual fundraising, for instance,
to support.
Yes, to support. And perhaps
okay.
that will allow them to monitor deeply what is actually happening in those communities.
Okay, thank you very much for that perspective, and because of our time we have to wrap things up here, but it's obvious that we have to do a lot. As a people, we have to be responsible and know that we must take up the responsibility of protecting our health centers and the investment in those health centers.
And while we're holding the government to account, we should also hold ourselves also accountable. Yes. And that is how we're wrapping it up on today's episode of the program. Please visit the news page of our website, primorgnews.org. For all the details of our reports and interviews, visit our website, www.primorg.org, to get all the information about Primorg.
And you can watch our videos on Primorg TV, our YouTube channel. Please subscribe to get reminders when we have a new post. We appreciate our guests, media consultant and activist, the Princess Halima Jibril. Thank you for joining us. And we also appreciate investigative journalist Elijah Akoji, who joined us via the phone, as well as Dr. Laz Ude, who also joined us via the phone. Public Conscience has the support of John D. and Catherine T. MacArthur Foundation, committed to building a more just, verdant, and peaceful world. Get more information about the foundation on its website, macfound.org.
Join us again here next week for another episode of Public Conscience. And remember to follow us on Facebook, Twitter, and Instagram at Official Primorg. I am Adaobi Obiabumo.
And remember that birth registration and birth certificate are both free if your child is under 18. Help stop the corruption in birth registration and do not pay for birth certificates. Also remember that you can give us information or hint about corrupt acts through our phone at 090-2265-6167 or info@primorg.org. I am Chidozie Obunnaya. God bless you.